By now, a lot of you have probably heard this or seen this that the CDC plans to drop 5-day COVID isolation guidelines. But the most important line from this early article that I found is right here that this is according to 3 agency officials who spoke on the condition of anonymity to share internal discussions. As well as this part that the White House has yet to sign off on the guidance that the agency is expected to release in April for public feedback. So before we fully dive in, I want us to pause at these 2 points and do a little reflection. If you'll recall, we had the same exact thing happen with the ACIP recommendations for the COVID vaccines, where for the advisory control on immunization practices, we had some anonymous source that was supposedly close to this that said, oh yeah, of course, everyone on the committee is completely unified and agreed that we're only going to recommend vaccination for the very old and the immunocompromised, no one else. But that ended up not being the case, and there was only one person that voted against the recommendations, so we can very astutely say that that one person was the one that released the information, where everyone else seemed to agree that it should be for everyone of all ages. I'm looking at you, Pablo Sanchez. You will not be forgotten. So it's very likely that these anonymous reporters are either ill-informed or, what I think is more likely the case, that the CDC is strategically releasing information to gauge public feedback to get an early indication of if their guidance change will be well received by the public. Because first, as the process goes, they're going to release this for public comment, and then once the public comment period ends, they're going to either sign it off or not sign it off. Which means that we have to be all over this and absolutely flood their feed when this becomes available for public comment, saying that we actually have to strengthen the isolation and quarantine guidance to a 10-day isolation period and a 5 to 10-day quarantine period, as current guidance does not follow the science. So now that we have that out of the way, let's actually look at what the proposal is. The first point is that this is going to be public self-administered isolation, where people who test positive for COVID can use clinical symptoms to determine when to end isolation. So they're switching to a policy of, it's up to you folks, where the official recommendation would be that people no longer need to stay home if they have been fever-free for at least 24 hours without the aid of medication and their symptoms are mild and improving. So that's actually 2 points right there, where the first option is you can go to work or wherever you want so long as your symptoms are improving and you consider them mild. Because again, what is mild? What are we considering mild symptoms? And then a secondary recommendation embedded within this is that you have to be fever-free for at least 24 hours without the aid of medication. Those are 2 different recommendations, but they're saying either or is fine. And this would mimic what we're seeing currently by the public health departments of California and Oregon. And these anonymous contributors are not sure what's going to happen with the masking mandates for the masking recommendation when you come back. My guess is that would be up to personal choice based off of the recommendations above. So again, all in all, very, very bad recommendations. Where the wildest statement is by Michael T. Osterholm here, who apparently is an infectious disease expert at the University of Minnesota. Shame on you. He says, public health has to be realistic. And making recommendations to the public today, we have to try to get the most out of what people are willing to do. You can be absolutely right in the science and yet accomplish nothing because no one will listen to you. So Michael thinks, oh yeah, we just gotta throw our hands up in the air and just give up. Just let people do whatever they want to do. Because they're not listening anyway, so why even try? Thanks, Michael. Really proud of you. Really holding to that scientific integrity and fighting for what's right. So obviously this is a bunch of garbage. The point of recommendations for isolation and quarantine is to make it so that, so let's first talk about what is isolation, what is quarantine. Isolation is when you take people that are knowingly sick or suspected sick with it, and you keep them away from the general public so that they don't spread infection. Quarantine is for people that have been exposed but aren't yet sick, where you keep them away, isolate them, and if they develop symptoms, they transition over to an isolation. So they can feel like the same thing, but they're different. Isolation is for already sick people. Quarantine is for people that aren't sick yet, but have been exposed and could get sick. And we set these recommendations to the strongest possible level to ensure that we are not continuing transmission within the communities. That is the intent behind these public health measures. Michael's statements here is not the intent. This would be called a bad scientist.